Okay, for the MC's introduction. And the second, I will introduce the second speaker, OVO. As I mentioned, she's our old friend and good friend. Okay. Sorry, for the privilege, make some mistake, okay? And I will introduce Dr. Wu Liu. She now is the Division Director of the Health Risk Prevention, Health Prevention Career Health Promotion Institute at the Republic of Korea, and also the Director of Academic Affairs, Korea Society for Health Education and Promotion, and also the Director of Academic Affairs, Korea Society of Alcoholic Science and Health Behavior, Republic of Korea. So she served a lot of government and admin involved. And Dr. Yu Liu earned her master's degree from the Ho Women University in 2002 and her PhD from the same institute in 2012. And her research is interested in cancer health policy, health promotion, and the disease burden, also disease equity, and also the impact of the climate change in the health. So he specialized a lot of the public health issues. And his achievement and his research highly correlate with the focus in about CCHP. And also in 2017, Dr. O worked as a researcher at the Korean Institute for Health and Social Affairs. So since he also became an expert in the health policy and the local health project from 2018 to 2021. And now his position is Director of the Non-Communicable Disease Prevention Department at the Korean Institute of Health Promotion. So, so far we invited her so many times in Taiwan. His empathy and his experience was highly collaborative with our main aim of our CCHP, and also we share a lot of experience from Korea. Since we are very cultural similarity between the two countries. So let's give the big pause for welcome Professor Hong Yong.
Good afternoon, everyone. My name is Yu. It's a great pleasure to be here with you, and thank you for inviting in this workshop. As mentioned earlier, Chair said my name is Yu, and I'm working at Korean Health Promotion Institute. Korean Health Promotion Institute core name is CAPI. CAPI means CAPI pronunciation similar to happy. So CAPI makes happy to people because people makes happy. So we call it CAPI. The CAPI develop health policy for the central government and develop and disseminate program and content for local governments. Today I would like to talk about current situation of colorectal cancer. And however, but I'm not expert on the cancer. But I work on public health and health promotion for 20 years. So my presentation will include strategies for preventing non-communicable diseases such as cancer. Now let's start the presentation. This is health status in Korea. Globally and Korea is same. The elderly population is increasing worldwide, and South Korea is no exception. In terms of socio-economic change, the growing elderly population has led to rapid increase in medical expense, Moreover, the result is great prevalence of chronic disease. In recent years, chronic disease has been the main cause of death in Korea. So in Korea, the The first is cancer, and second is cardiovascular, and the sixth is diabetes, and tenth is hypertension. So cancer is very common and the main cause of this. Let's take a look at the main cause of this by age. So among people from 10s and from to 30s, suicide rank as the leading cause of this. But among the people 40 and over, cancer is leading cause of this. So you can see the cancer is leading cause of this. Why chronic disease is the main cause of death? Because health risk factor. So from the perspective of the health behavior and equity of individuals, situation is getting worse. So smoking rates among adult men are still high, and physical activity is decreased from pandemic. And there is a decline of quality of diet to the consumption of large quantity of alcohol and omission to breakfast and eating out. And furthermore, in Korea, we focus on equity. So income polarization is causing disparity to persist. As a result, health inequity are widening across the region and income level. Therefore, we need to improve equity through policy innovation. And nowadays, very hot. So that is related with climate change. So in addition, our country and entire world are experiencing climate change and environment change. The rate of new infectious disease caused by climate change is growing. This issue must be addressed both individually and globally. And the use of ICT technology in healthcare is advancing. As interested in health growth and the demand for healthy lifestyle increase, the public medical is gradually shifting from treatment and to management, and management to wellness. The demand will expand the importance of digital care, which utilize various new database technologies. Nowadays, we have a new president, so they focus on digital care and AI. So it's time for a paradigm shift in health policy. As the population structure has changed from a production-oriented structure during the high growth period to a super age structure during the low growth period. Therefore, a paradigm shift has become necessary. Government focused on prevention and wellness-based approaches. So when people get sick, they rely on policies that cover medical costs in hospital. Nowadays, government preventing illness and maintain health over long periods of time while enjoying a happy life. To achieve this goal, a comprehensive approach is required, including the following: so prevent and early response to illness, and managing a risk of chronic disease, and providing comprehensive support linked to various health resources, and promoting health and happiness through health living life. So we will begin our presentation on cancer. They will cover incidence and survival rate and prevalence rate. First, let's read the current cancer incidence rate. According to the recent data, thyroid cancer has the highest incidence rate, followed by colorectal cancer. You can see the graph. And so that is first is thyroid, and second is colorectal cancer. And lung cancer rank is third most prevalent type in cancer. The incidence rate by gender are shown in the graph. So for orange color is woman, and then blue color is man. So the most prevalent cancer among women are breast cancer and thyroid, and third one is colorectal cancer. For men, the most common cancer are, first one is lung cancer and stomach cancer. I can't see nothing. Stomach cancer, and third one is colorectal cancer. So colorectal cancer is a high incidence rate, both men and women. The incidence rate by age group are shown in the table. Colorectal cancer is the second or third most cancer in all age group. It's also important to note that the incidence of thyroid, breast, and lung cancer is also high. So you can see the graph this table. When compared with the international rate, South Korea cancer incidence rate is 287 per 100,000 population. The rate is lower than US and UK, but higher than Japan and China. So I found the Taiwan incidence rate, the incidence is more higher than Korea. So, but in Korea, South Korea cancer mortality rate is 77 per 100,000 population, the lowest among the major comparison country. So that is the bar graph summarizes the previous mentioned point. The rate is defined age standardized incidence rate, the mortality rate per population. So horizontally in incidence and vertically is mortality. So Korea has low mortality, but incidence is higher than China and Japan, but it's lower UK and USA. And Asia and Oceania has low incidence and low mortality. It's similar situation. The following is the survival rate. Over 70 of cancer patients survive for 5 years or longer. The 5-year relative cancer survival rate for patient diagnosis in their past 5 years is 72.9%, almost 73%. And the 5-year survival rate is higher for women than for men. This is likely due to high survival rate thyroid and breast cancer, which are more prevalent among women. According to the statistics, thyroid, prostate, and breast cancer has the highest survival rate, but lung cancer is low survival rate. That means mortality rate is very high. The following is the cancer survival rate. Over 70 of cancer patients survive for 5 years or longer. The 5-year relative cancer, you can see it. The women's survival rate was high in thyroid, prostate, and kidney cancer. Colorectal cancer also show high rate, 75.6%. And for women, the top 3 cancers are thyroid, breast, and uterine. Colorectal cancer also has a high rate, 73% to this one. And please find the relevant information below so you can see colorectal cancer. And this is prevalent rate. That is very similar to incidence rate, but prevalent rate was higher for thyroid and stomach and breast. The fourth is colorectal cancer. The following table shows the prevalence rate by gender. For men, the order is stomach and colorectal and prostate cancer. For women, the most common cancer are thyroid, breast, and colorectal cancer, except for lung cancer rate similar to prevalence rate. That is not a prevalence. I'm sorry, but this is incidence rate. So Korean is higher than Japan, but mortality rate is very low about colorectal cancer. So the government is promoting various policy and programs to prevent cancer and support treatment. So cancer is leading, as you see, cancer is the leading cause of death worldwide. The WHO said that about 1/3 of people with cancer can be cured if the disease is detected early and treated early. Advanced countries implement cancer screening program to reduce cancer-related deaths. And South Korea also provides such a program to the high incidence of cancer, and they need the national management. The program aims to prevent cancer, detected early, treated and facilitate rehabilitation of national scale, thereby extending health life expectancy and reducing cancer-related deaths. That is key strategies 3. So one is expand early screening. Second one, provide access to the latest treatments. Last one is support prevention and rehabilitation. This is a detailed overview of the National Cancer Control Program. We have 4 categories. So one is cancer screening and treatment and prevention, care, including patient and family support project. So cancer screening provides a national cancer screening program and management program targeting risk factors for cancer. Cancer treatment help low-income patients with medical expense by providing financial support and assistance through regional cancer centers. The cancer prevention category involves producing national cancer registration and strategy and provide cancer-related information and offering health promotion program. Cancer care support patients and their family. They include the home care patient care program, cancer survivor integration support project, and hospital project. That is National Cancer Screening Program. So the government provides regular cancer screening free of charge. The table below lists the type of cancer screening, target group, and screening interval. So colorectal cancer is here. Provided annually for men and women aged 50 and older. The screening method is fecal occult blood test. So that is screening method. So a fecal occult blood test, if the result is positive, followed by colonoscopy and then biopsy. Here are the details regarding colorectal cancer management. Free annual colonoscopy are offered to individuals aged 50 and older. If cancer is detected, treatment options may include surgery, chemotherapy, and radiation therapy. But prevention campaign and educational program also focus on lifestyle modification, such as improving diet and exercise regularly to reduce the risk of colorectal cancer. The National Cancer Center and Specialized Colorectal Cancer Treatment Hospital implemented this initiative to increase the early detection rate, improve survival outcomes, and reduce success the treatment. Cancer, including colorectal cancer, is the leading cause of death. While treatment is important, but prevention is chronic disease such as cancer is even more important. So we would like to introduce policy and delivery system related to the prevention of chronic disease. This is a diagram. Policy for prevention of chronic disease are linked to international policies such as UN and WHO. Government policy of the Ministry of Health and Welfare and local policy and project of local government. Internationally, the National Health Plan, we established the National Health Plan every 5 years. And plan established by the central government and linked to regional health plan. And local government, they implemented the health promotion program. We will consider approach at both the individual and community level to prevent communicable disease. First, we will implement education and campaign at the individual level. That will include providing information on the cause of colorectal cancer and educating people how to prevent thereby factor. The detail for the educating information, the risk factor and preventive method. So diet, preventive obesity, and screening, physical inactivity, alcohol consumption, smoking, and general screening. So that is health living strategies. So the National Cancer Center has developed and promoted the health guideline for the prevention. The following are 10 recommendations. But everyone knows this recommendation of avoiding smoking, eat balanced diet, but in the reality, not many people follow them. That's why we provide information and run campaign. This is a campaign poster. This is a poster, Prevent Cancer Starts in New Days. So this poster on physical activity, she is very famous actor. So she said exercise every day. And this one is dietary messages. So famous chef provide such as don't eat burnt food. And this message also include avoiding fried and salty food. Middle one is doctor. So doctor said get regular cancer screening. And last one is stress management. So do not use alcohol to relieve stress. Community level, we have a community healthcare system in Korea. So while individual level approach the time is over, but I explain about that in about 3 minutes. Why individualist approach are important is equally essential to leverage community resource in directing problem local residents. Ministry Health and Welfare Central and Provision and City provide make a budget and have a plan. And implementation system is here. So we have a public health center nationwide. So we have a 261. And the smaller town and county has a center for supporting health living and public health units. And medically unserved area about rural, the smaller one, it is primary healthcare post. So we have 3,500 public health center, we have it. So that is role of the initiatives. So this is our CAPI's roles. So conducting program monitoring, offering planning, advice, and capacity building, and evaluation, feedback, and local healthcare plans, and so on. And education agency is other organization. So I talk about public health center. Public health center has a rural primary healthcare service and health promotion program, infection disease and health administration. So about pandemic, they have a very important role to the public health center, but the main job is health promotion program. So there is smoking cessation service or alcohol control service or preventing obesity and so on. And this is the detail of health promotion program, and but I will explain about the title. We have no time, so we have I just about the title, the programs. So smoking cessation service about we have every public health center have a smoking cessation service. So they provide 9 sessions about 6 months period. For heavy smoker, we have a tobacco-free camp. So we provide RNA cleaning prescription for doctor. And youth smoking prevention program for school and nutrition management for elderly. So nutrition plus program for pregnant, vulnerable pregnant. So we provide education and supplement with food. And physical activity for elderly and health promotion program for children preventing obesity. So we educating and doing play program. And we have a national campaign. So obesity prevention campaign online. We utilize SNS, mobile, and offline. We through public health center and working progress. And so we use public digital healthcare service in Korea. So we have we provide activity methods and body composition methods and glucose sensor and automated blood. So we check the nutrition and physical activities. So we consulting team, doctor, nurse, dietitian experience, exercise prescription. So they get a real-time consultation. That is my last presentation. To prevent non-communicable disease in the future, the following areas should be considered. At the individual level, we need to provide information tailored to each person's literacy. And we provide customized health counseling and program according to the individual health status. So for individual level, the important is health literacy. At the community level, we focus on targeted and comprehensive messaging from treatment to prevent. We are implementation and integrated health promotion program and collaborating with the community sources, including public and private sector. The content is about governance. So last one I want to say, establish a multi-sectoral government system is needed. So we advance the health policy approach with the collaborative governance framework involving not only health sector, but also land planning, environment, and we need private sector. That is my end of presentation. Thank you for attention. Thank you.
Okay, we will have a very limited time, only one question. Any question? I wonder, you talk about public digital health services in Korea. I will know how many people can take this kind of service. The public rate.
Yes. I think one public health center, they manage 100 or 200 people. So we have 261 public centers. So with too many about I cannot calculate, but it's many people involved with. And furthermore, we use AI, so many people get a service more than now.
Yeah, if you really provide a data frame using the AI to predict.
Yes. Yes.
Okay. So thank you.
Thank you.
And let's thank you again for the Dr. for a very good speech. Okay.
Thank you.